Welcome to Vigyan Setu Foundation, an effort to bridge science and society. The following presentation has been made by Vigyan Setu Foundation as a part of its commitment towards raising awareness among the society. Thyroid disorder is a silent disease affecting all populations across the geographical boundaries, gender, race, religion, and even species. It has a global presence. To control it, two key essentials are widespread thyroid function testing and identifying iodine deficiency in both developed as well as developing countries. Every year, on 25th May, World Thyroid Day is celebrated with the objectives of 1. Raising awareness about thyroid health, 2. Promoting know-how about advances made in the field of thyroid therapy, 3. Reinforcing the ubiquitous existence of thyroid diseases, 4. Educating masses on prevention programs, and 5. Creating awareness about new methods of treating thyroid diseases. During the week from 25th until 31st May, Vigyan Setu Foundation joined hands with the international fraternity in celebrating Thyroid Awareness Week by releasing 7 presentations, one on each day. It is indeed our endeavor to make everyone know about thyroid. Till now we have seen functions of thyroid gland that affect health or well-being. Now we will try to understand malfunction of thyroid gland. For the malfunction of thyroid gland, there are many reasons or predisposing factors responsible. Most common and important of these is iodine deficient diet. We know it is absorbed iodine that helps in production of thyroid hormones. Certain individuals are genetically prone to autoimmune thyroid diseases. Then in certain families, thyroid problems run through generations, making it a hereditary problem. Females are found to be more susceptible. Tobacco contains substances that can impair iodine absorption by thyroid gland. Caucasians and Asians are more vulnerable to thyroid disorders. Mostly man-made chemicals such as pesticides, metals, additives, and the likes are endocrine disruptors. Having understood what are the predisposing factors, now let us know about types of thyroid disorders. These are hypothyroidism, hyperthyroidism, goiter, also called as iodine deficiency disorder, Hashimoto's thyroiditis, and thyroid cancer. Now we will understand what are the causes and symptoms of these disorders one by one. Hypothyroidism. Hypo indicates less than normal. In this condition, thyroid gland is underactive and thus produces low levels of thyroid hormones. There are a number of factors that could lead to such a condition. It includes iodine deficient diet, autoimmune disease like Hashimoto's thyroiditis, if being treated for hyperthyroidism with excessive dosage, or anyone who has undergone thyroid surgery, radiation therapy could also show the symptoms of hypothyroidism. Disorders of hypothalamus or pituitary gland could also result in lowering the levels of thyroid hormone. Pregnancy could also be one of the factors for making the thyroid gland to underperform. Although in early stages, the signs and symptoms get confused with those of the other common diseases, but as the severity increases, the symptoms start to become more and more obvious and noticeable. We know thyroid hormones are responsible for metabolism in the body, and the decreasing levels of hormones, fatigue, tiredness, and exhaustion sets in. Mental faculty shows anxiety, apathy, and even depression. Due to slowing down of metabolic function, one starts putting on weight, which becomes difficult to shed. Skin becomes dry and develops itching sensation. There is more sensitivity towards cold. face, hands, and feet looks puffed up. Hair fall is excessive, and even thinning of hair is noticed. Heartbeat is typically 10 to 20 beats slower than the normal in hypothyroidism. Low levels of thyroid hormone affect bowel movements, resulting in constipation. Other symptoms include forgetfulness and lack of concentration. Voice becomes husky. Muscle pain associated with tenderness, stiffness, and weakness. Blood cholesterol shoots up, and thyroid gland may show enlargement. In addition, in females, menstrual periods are heavier than normal and irregular. Children and teenagers may also show the same signs that of the adults, as what we have seen in the earlier slides. But in addition, they may also exhibit stunted growth because of suppression of growth hormones. Even their permanent teeth development is delayed. Brain development slows down, and in girls, attaining puberty too gets delayed. Negligence in taking care during pregnancy could have adverse effect on the newborn. Likewise, in infants, there are certain noticeable symptoms indicating hypothyroidism. Hands and feet become cold, bloated stomach with constipation, tongue is swollen and protrude out, causing poor feeding, excessive of drowsiness and floppiness of body. Cries have husky sound, arrested growth, persisting jaundice, difficulty in breathing, and umbilical hernia are the symptoms of hypothyroidism in infants. In the next presentation, we will know about hyperthyroidism. Till then, take care. Thank you for joining us in raising awareness about thyroid. Do keep in touch.